Gene therapy is still in the works. Now, what are the drug classes that are used in Parkinson's disease? They're dopaminergic agents like levodopa or the Sinemet, and dopamine agonists. We have other drugs which are called like COMT inhibitors, MAO-B inhibitors, anticholinergics, and amantadine, and I'm going to go into more details about each one of these classes. Levodopa or Sinemet. This is a precursor to dopamine. So levodopa is something that the body uses to make more dopamine. This is one of the earliest therapies for Parkinson's disease. It was introduced in 1960s. And this is the most effective. It's the most potent medicine for Parkinson's disease. And it helped to control all symptoms of Parkinson's, and all patients eventually require levodopa. It has a lot of side effects like nausea and vomiting. When you're on the medicine for some time, initially you'll feel the nausea and vomiting, but with time this does get better. Another way of getting by nausea and vomiting is to take Sinemet with meals. Another side effect is orthostatic hypotension, which literally means that you have a drop in your blood pressure when you get up suddenly. Drowsiness, sleepiness is common. Hallucinations are common with prolonged use of levodopa. And dyskinesias. Dyskinesias are abnormal dance-like movements, writhing kind of movements, and they come on with long-term use of dopamine, of levodopa. And this is one of the side effects that limits the use of levodopa for long periods of time. Another class of drugs is called dopamine agonists, and I'm sure you've heard of these names before. Now, with dopamine agonists, we have different routes of administration, like we can give them by various different ways, by oral, patch form, or an injectable form. Apomorphine or apokin, this is an injectable form of dopa agonist. It's a very good medicine for rescue. Like when you saw in my patient, when she froze, she would be a good candidate to get apokin. She can give herself a shot, and within 10 minutes or less, she would be moving fine. And the benefit lasts for about 90 minutes. Pergolide or Permax. This was another medicine. It has been taken off of the market since March 2007. The reason was that they saw a lot of patients had trouble with their heart valves when they were on this medicine. It's off the market now. Mirapex and Requip. Pramipexole and Ropinirole. These are medicines that are taken by mouth, and they have equal efficacy. They both act the same way, and both are equally good. Rotigotine or Neupro patch. This is a patch form of medicine. This was introduced very recently, and recently it has also been taken off of the market. It had good benefit, but the way it was manufactured in US, it had a lot of crystals in the patch. So when the patients put them on their body, they were not able to absorb the entire medicine. So the patch was recalled because of a manufacturing defect and not because the medicine was not working. Adverse effects of the dopamine agonists as a class is drowsiness and sudden sleep onset. So we always warn our patients when we start them on a dopa agonist to take a few days to see how the medicine sets with their body, because sometimes you can have a sudden sleep attack, like when you're driving, for example. So you want to know that your body is able to handle this drug well before you do something like driving. Nausea, vomiting, orthostatic hypotension, and psychosis. Now, this is a particularly important side effect of these drugs because psychosis is more prominent in elderly. By elderly, I mean someone over the age of 70 or 75 years of age. So psychosis is a big side effect for those patients. Another side effect is impulse control disorder, like pathological gambling, hypersexuality, or excess shopping. And so when our patients tell us that they're having these side effects, we take them off of the medicines. Another set of drugs is called COMT inhibitors. What this really means is catecholomethyltransferase. It's a long name. What these medicines do is when you take them along with levodopa, it helps to prolong its duration of action. So if you take Sinemet alone, it might act for maybe an hour or two, but with the COMT inhibitor, it prolongs the effectiveness and the duration of action, and now the drug would be, you would able to work with the same dose of levodopa for about 3 or 4 hours. The drugs that are in this classes are Comtan or entacapone, and Tasmar or tolcapone. There's another combination of drugs called Stalevo, and it uses levodopa, carbidopa, which is the Sinemet, and entacapone in just one pill. So instead of taking 2 pills, we can take just 1 pill. The adverse effects are diarrhea, which is common to both those drugs, and a hepatic failure. Now, this is common only with tolcapone or Tasmar, and that's one reason why it's not used too frequently, and if it is used, we check their liver functions very often. Another class of drugs is MAO-B inhibitors, and that is monoamine oxidase type B inhibitors. What these do is they slow the breakdown of dopamine in the brain, so the brain can see more dopamine for more time. The various agents are Azilect or rasagiline, Aldepril or Selegiline. These are both tablets, so you need to take them with water. Selegiline dissolving tablet called Zelapar. Now, this is a wafer form of tablet, so when people wake up in the morning and they cannot get to a glass of water, or they're feeling like their symptoms have returned, they can take this wafer, just put it on their tongue, and it dissolves rapidly, and it tastes pretty decent too. Side effects are insomnia, hallucinations, orthostatic hypotension. And now these are pretty much common to most of the drugs that we use for Parkinson's. Serotonin syndrome. There are certain antidepressants that interact with these set of drugs and can dangerously raise the blood pressure. So we need to be very careful that they're not on these medicines before we introduce Azilect or Selegiline to them. There's another thing called the tyramine reaction. So patients who are on Azilect or Selegiline, we tell them not to take things like aged cheeses, wines, or cured meats, because they can have a tyramine reaction where they can have flushing of the face, high blood pressure, and things like that. Anticholinergics, these are very seldom used. They're effective against the tremor and the rigidity, so they don't help with the other Parkinsonian signs, like they do not help with the slowness, or they do not improve balance. And they have a lot of side effects, especially when they're used in the elderly. And the agents are Artane and Cogentin that are used. Amantadine, this is also called Symetril. And this is actually an antiviral agent. It's a very mild Parkinson drug, and it does not help so much with the motor symptoms, motor meaning the slowness, the rigidity, the poor balance, but it does help to control some of the side effects like dyskinesias. And again, it has so many side effects, like the common ones to all PD meds. Then you can have dry mouth, ankle swelling, and skin mottling. This is particularly common, like in the lower extremities. You might notice that the skin color changes. And when that happens, you should let your doctor know. How do we decide how to treat Parkinson's disease? The decision really depends on how severe the disease is, how much functional impairment there is for the patient, and what is their quality of life. Other things we take into account is the age of the patient. So there are certain drugs like dopamine agonists, which have a lot of side effects like hallucinations, agitation, confusion. So we try not to start them in the elderly population as the first drug of choice. Levodopa, though this is one of the best drugs we have, but with continued use for about 5 to 7 years, patients develop side effects like dyskinesias or motor fluctuations, which I will go into more detail. So we try to defer the use of levodopa in a young patient, but in an older patient, that'll be our first choice. For a younger patient, the first choice would be a dopa agonist. So if my patient has mild Parkinson's disease, what do I do? Sometimes after discussing with the patient, we come to a common conclusion that probably it's not early enough to start any medication. Maybe they just have a mild resting tremor, which is not interfering with their daily life. And we can just watch them, and as and when the disease progresses, we can introduce different medicines. And if at the first visit and they have mild Parkinson's disease, but they feel that they're not able to function as well,